Hi, I'm Dr. Shu from Line Plastic Surgery here in Los Angeles. Today we're going to talk a little bit about Ozempic face. Recently we've been getting a lot of questions about Ozempic face. So what is it? Basically, Ozempic face refers to the facial phenomenon where you sort of have less volume, maybe some hollowing out of the face because of rapid weight loss. And the rapid weight loss being due in this case to Ozempic or drugs that are similar in the same category. In fact, this is not really a new thing for plastic surgeons. We've been used to this and dealing with this for a long time, even before Ozempic, because we've been dealing with rapid weight loss from another cause, bariatric surgery. And that's been going on for decades. So this is something that is, on the plastic surgery side, not completely new. The only difference is that the patients are getting the weight loss not from gastric bypass surgery or lap band surgery or gastric sleeve surgery, not from any of those, but instead from injection or a pill like Ozempic or one of the related compounds. For the face and for plastic surgeons, the issue is the same. When there is a lot of weight loss, typically the volume is gone and the skin will tend to sag. The skin sags partly because of age and partly because it may have been stretched out a little bit from the previous volume that was there. Now, we'll see this all over the body, but people are asking mostly about the face. Now, traditionally, we think about facial aging as a sagging phenomenon. But as many of you may know, a few decades ago, there was more appreciation for the fact that when our faces age, they not only sag, but they also lose volume. So you can see where weight loss, for example, from Ozempic or previously from bariatric surgery, with the volume loss that occurs in the whole body and including the face, that's half of the equation for facial aging. Facial aging, they sag and they lose volume. Well, if you're losing volume from fat loss, that will cause a little bit more of an aged appearance. For facial rejuvenation, they really need two things. One is lifting to address the skin sagging, and one is volume replacement to address the volume loss. In the case of Ozempic, it's a very rapid volume loss, and therefore it's kind of dramatic. People think, well, it looks so different than 6 months ago, and that's true because the weight loss has been pretty quick. But people may lose that weight normally, naturally over decades sometimes, and it will be more of a gradual thing. And some people will ask, well, with Ozempic, since it's a more rapid weight loss, does that cause more volume loss or more sagging because it's so quick? I think the jury is still out on that. I don't think the research is very clear about whether the speed is an issue or just the sheer volume loss. But even without speed, volume loss itself will cause a little bit more of an aged appearance. At Line, and for a lot of other plastic surgeons, typically to address the Ozempic face look or the little bit more aged appearance, we'll basically try to address both these things. Facelift to lift things up, usually with a neck lift because they usually go together, and then some type of volume replacement, whether that's injectable like a filler or a Sculptra, or whether that's fat grafting, which is done surgically. Both are okay. But typically to address that Ozempic face type of look, that more sunken look, you have to do both. So there's something to address the sagging and something to address the volume.